Ankura Hospital for Women and Children welcome you all to the session. Ankura Hospital started its journey in 2012 with its first center at KPHV. Today, Ankura emerged as a leading chain of women and children hospital in the state with more than 500 beds. We have exclusive behavioral pediatrics department and child development center. Further coming to the session, which is all about development of children of age group 2 to 5 years. It's my pleasure to introduce our expert doctor and speaker, Dr. Shruti Mishra. Dr. Shruti Mishra has completed her MBBS MD Pediatrics and fellowship in development behavioral pediatrics. Dr. Shruti Mishra is consultant development pediatrician in Ankura Hospital. She has more than 7 years of experience in this field. She is passionate in dealing with the challenging children and understanding their behavior. She is also a life skill trainer for adolescents. So, I would like to invite Dr. Shruti on this virtual platform to give an insightful and interactive session. Thank you, ma'am.
Thank you, Pooja, for the introduction. So today we'll be discussing a very important topic, and as Pooja already mentioned, we'll be discussing about development of children between 2 to 6 years of age. I'll just take a few moments to share my screen. So when talking about development of a child, so it's something which is very much interlinked with one another. Okay, and what I would like to So what today we'll be doing is discussing the normal development first, because unless we discuss the normal, we won't be able to go to the and identify the abnormal things. And next, we will be discussing some red flag signs, which are the signs for developmental delay in children, and few basic tips to manage the behavioral issues, which is a lot faced by your parents at this age. So why development? Why do you want to talk about development today? So as we are seeing in this thing, so there is some concept known as neuroplasticity. So what does it mean? So when we take the brain of a child after birth, it is something like a mold we can talk about. So whatever impressions we are giving on there, it is moldable. We can mold the brain, and as time passes, then this moldability of the brain decreases. Okay, and as you can see in this graph, so at the time of birth, the brain has few neurons, I would say, and definitely it multiplies into millions neurons. It makes millions synaptic connections every day, and then finally, after 6 years, the brain starts to specialize those neurons, like the nerve cells. What I'm talking about. So the nerve cells, which are actually used more frequently, that gets good connection, and the ones which are not used, it is eliminated out. So the first years of life is very important in this field, because if we are talking about something as hearing, so when any kind of hearing issues which is identified within the first 6 months and intervene, means if the child is tested, and if there is any issue, if the child is provided with aids or something, and then the child is trained for the speech and all, then the development of that child will be compared to that of a development of a child with a normal hearing. Okay, so and but if this time is not utilized, if the child is not intervened or treated till, I would say, about 1 year or 2 years of age, then these neurons start to degenerate. The brain starts to lose them all, and then at that time, even if the child is intervened, then we don't get the result which is as good as once if the intervention is started earlier. So same way it is with regards to the language as well, and with regards to higher cognitive function. So early intervention is the key, as I was talking about, because what happens as the time elapses and if the child is not intervened, the gap increases, and then we are not able to cover those gaps. And also, as I was telling, so development is something which does not only depend upon the child's genetic factor, but it is also influenced by the family and what we as a society are providing to the child. So it is nature and nurture, and we as an adult, as a caregiver, as a sculptors, like we can sculpt the brain of our little ones. So when we talk about domains of development, there are few domains of development which I'll be dividing the milestones into. So it becomes easier for us to understand and work. But mind you, it is not something very exclusive. For example, it is not only that the motor development will happen at one pace and the socio-emotional will happen. It is mutually exclusive. It is inclusive, interdependent on one another. So when we are talking about physical development, it is divided into gross motor, like we start from the babies start from holding their neck, then holding their bodies, getting a good trunk control, then starting to walk. All these are gross motor development. Next comes the fine motor development. So, what are fine motor development? Anything that we do from our hands, the fine motor skills with regards to writing and with regards to means these all this stitching, buttoning, unbuttoning, all those things. So, next comes the socio emotional issues. So, how the child interacts with their surrounding. Okay, the sensory issues is like our vision, our hearing, all these kinds of things. And then this cognitive, the cognitive domain includes anything like how do we solve the problems of a thing, of our anything that is presented in front of us. And then comes the communication. So communication is anything which is it is always divided into a verbal and a non-verbal component. The verbal component is how we speak, and non-verbal thing is like what we are able to do about our like suppose when I'm talking, we do various kinds of gestures, and what we shake the head in no. So all these are non-verbal components which are equally important, and I'll be discussing about it in the later slides. So talking about 2 years milestones. So one more thing I want to mention about is like these milestones are achieved not at one time, but there are age ranges which is normal. So for example, when we are talking about walking, so a child can start from anywhere walking from 8 years till 18 years of age. So what in the next few slides we'll be discussing about is like what is the upper age limit, and it is mostly at which beyond which if the child is not achieving the milestone, it is a red flag sign. So most of the children by this age will be having a good walking, okay, and they starts going upstairs 2 feet per steps, coming downstairs, running backwards. They can climb onto furniture which they like a lot, jumping with both feet by 2.5 years of age, and walking on tiptoes when asked. Why when asked? Because the child if continuously walking on a tiptoe, then it is again a red flag sign. And next, coming to fine motor skills. So they start developing a good grip by 12 months of age, and then they start to hold the pencil. They can scribble by 18 months of age. If you give them cubes, they can make a tower of 6 to 7 cubes. They can feed with spoon without rotation, and then spontaneous scribbling, as I told you, turning pages 2 to 3 pages of book at a time, turning the doorknobs, unscrewing the lids, etc. Next, with regards to the fine motor skills, so they can take off the gloves, they can unzip, they can dress themselves, they can open the cabinet drawers, they can hold their pencil in the hands instead of fist by 2 years of age. And when we talk about the language, so language development is divided into receptive and as well as an expressive. So what is receptive? So whatever we understand. So suppose by 19 months of age, the child will be able to understand two steps command, and like mom, come here and sit down. So bring come here and get that book. So things like this. These are two steps command. And what is expressive? They will be able to whatever the child is able to say. So by 25 to 30 months of age, or I would say when we are talking about the language milestones, so for 2 years, two word sentences, both understanding and both telling. Apart from that, they can point to pictures, they can understand pronouns. Next, coming to 3 to 5 years of age. So, gross motor, the child will have a good coordination. They'll start to have more and more coordination, which will be reflected when they can ride a tricycle. They can go upstairs and downstairs. 1 feet per step means like an adult, like this. They can dance, they can skate, and they can skip by 4 to 5 years of age. And talking about the fine motor skills, they can fully dress and undress themselves, and they can start buttoning by 4 to 5 years of age, and tying shoelaces up to 5 years of age. They can use the fork even if provided with an opportunity to do so. Though in India, like some houses may not like they are used to having food with hands, but that is absolutely fine. And therefore holding the pencils and making various diagrams like square, rectangle, triangle, all these things, brushing teeth and cutting with small scissors. So you can see by we 3 years of age they start to build various kinds of shapes with a like blocks. Like at 3 years they can build a bridge, by 3 to 4 years of age they can make a gate, and by 5 years of age they can make steps. And also when we are talking about pencil skills, by 3 years they can draw a square, sorry, they can draw a circle, by 4 years they can draw a square, and by 5 years they can draw a triangle, or they can write print their names as well. Also talking about the language, so now the thing is, by 3 years they would start to speak 3 word sentences, they would understand what and where questions. By 4 years this becomes more complex, they can understand 3 steps command, points to colors as well, and they will understand, they will know their name and gender. Like suppose you're a boy or a girl, they know that I am a boy or I'm a girl. They may say small stories also, their imagination also comes into play by this age. And speech should be clear by 4 years of age, which is 100%, it should be clear, except for few L and R things that may take more time for some of the children to articulate. And by 5 years of age, they use adjectives, and they can define simple word. They can tell the difference between right and left. So, talking about preschoolers' cognition, at this age, generally they will understand the shapes, numbers, colors, and they can count the numbers from 1 to 10 and all. And at this stage, between 2 to 6 years, they have a very pre-operational stage of development. So, what does pre-operational means? So, by 2 to 2.5 years, they will understand like what is good and what is bad. They may not hit others if we tell them this is bad, but they won't understand that it will have an implication of other, that they might hurt themselves, which they start understanding gradually by 3.5 to 4 years of age. That is taking each other's perspective. Like it may, they may say that the baby is crying because her mom is not there. So these things they take into perspective. And socio-cultural norms. So whatever they are seeing, they imitate the adults in every way. So how we are eating, how we say, how you greet others, like saying namaste or saying hello, or these are imbibed in the kids, and they readily participate in joint attention. They love very much, and if any adult or other kids are playing with them to and fro, they start learning with them. Gender awareness starts by 3.5 to 4 years of age, as I was already talking about. Not only with regards to the gender, means the labeling, but also like they tend to imbibe, like they might like to wear the sari of the mother, or maybe the play, the kind of play that they are doing. So all these kinds of thing also emerge. And therefore, and reality is always confused with a fantasy, so more of a fantasy or pretend play. So when you ask them like what will you be when you grow up, they might say it as a prince and princess, and means understanding that yeah, it is possible for them to do so. So play is a very very important thing. It is a very important milestone, because with play what we tend to know is like we can understand the cognition of the child at which stage they are, and it is very easier to teach the child via play skill. This is the only way which we can interact with the child. Okay, so pretend play, first by 2 years of age they'll start to do a lot of pretend play as well. Okay, like they'll take something and call it as a phone, or they may pretend something and wear it on the head, vessel or something like that, pretending it to be a hat. And then first it is on their own body, and then gradually they do it on the others, like a doll's thing. They may, like in this picture, the girl is trying to feed the doll. And at by 2.5 years the play is usually parallel. They may just sit down to play with someone, but they may not cooperate very well, which comes by 3 to 4 years of age. They start playing cooperatively, and more of a role play. Children enjoy to be, like they may enjoy to be a teacher, they may enjoy to be a chef, like in this picture. So they do a lot of role play with a lot of fantasies and all. They may pretend one thing to be other. Suppose in a, they may pretend it is a tea party, and they may put small pieces of paper and pretend it is a biscuit. So these kinds of imaginative play, it helps in developing the overall skills of the child. Most important, socio emotional milestones. So this at this age, till 1 year of age, actually the children, they don't see themselves much different from the parents. It's like they are dependent for everything on the parents, like right from feeding to soothing them. But by 1.5 years of age, they develop this awareness of self in relation to other, they that they are a different entity, and they can do things as per their way also. Also, they develop a lot of intense emotions. They want to master everything, and once they have mastered it or they have done something, they will look towards you with for praise, like, or they may also say like, mama, see, I have done this, so clap. So these kinds of thing they will do. And though the emotions, it is difficult for them to control sometimes, so that leads to small tussles like temper tantrum or thumb sucking or toilet training, which we'll be talking about later. And most important is social referencing and joint attention. So when we are sitting to engage with the child, or we call out the name, or we are talking to the child, the ability of the child to focus attention on that thing about which we are talking, like suppose a toy, or maybe pointing towards thing what they want, which is known as proto imperative pointing. Or if they have seen something like, look mama, this is a dog. So this is also very important milestones. So, with this, I would like to say that because the child is developing such with a such rapid phase, and there is a lot of change in the emotion, cognition. So frequently, we have to support the child as well as try to give the baby some independence also, because they do learn in that environment better. Also, if we are presenting anything to the child, like if we ask them to learn a task and all, it should be tried to divide. We should try to divide it into small chunks, it's small steps, so that it becomes easier for them to learn as well. And definitely we have to uh, be a good role model for the child, because like the child, as I was telling, they will be imitating the adults definitely. So what are the red flags? If the child cannot do the following, these are red flags. Like if the child is not able to sit unsupported by 12 months, if the child is not able to walk by 18 months, if the or if, as I told you, if the child is only walking on tiptoe, and the child is not able to run by 2.5 years, so these are the motor red flag signs. Like these are signs of developmental delay, and definitely you should reach out for a intervention for this children. Also, if the child is not gesturing bye bye by 12 months, or if the child wants you to take the him up, so if he is not able to hold out the arms to be picked up, there is no word by 18 months of age, no understanding of simple commands like bring your shoes, bring your socks, without pointing, okay. And he does not point to what he wants by 18 months of age and what interests him by 2 years of age. So all these are again a red flag signs. So as I was telling, 2 years the child should definitely speak 2 words phrases, 3 years 3 words phrases, and by 5 years the child should be able to narrate like 4 5 sentences, story kind of thing the child should be able to tell. If anything the child has not achieved, then definitely these are cause of concern. And there are some myths about delayed language. Like we always wonder whether in a multilingual family, if we are speaking 2 or 3 language for a child, has that led to developmental delay or delayed speech in the child? Or suppose many of our parents would say that this is a male child in the family, we have history that the child will have delayed speech, and in our culture the male child speaks late only. So these are actually myths. Okay, it is invention said that in a multilingual family, the child develops the language in the same way as in a monolingual family. So it is not that if we are using a lot of languages, it will lead to speech delay in a child. It's not so. And but like any child who has a delayed speech and language, for he is at a risk of developing a learning disability, which in most commonly term we use as dyslexia in future. So we have to actually address those issues and intervene. So with this, I would like to talk about few important signs of autism. So what is autism? So it is a neurodevelopment disorder. And why am I telling you this now? Because this age between 2 to 6 years, I would say rather from 1 to 6 years, it is very important. Like if we are picking, if we see these signs in our children, any issues, we should definitely take the child for consultation and start intervention, because then we will be losing out golden opportunity. So what is autism? As I told, there is different kinds of wiring in the brain in which the child has socio emotional issues. The child may have delayed language, and the child is not able to communicate well. Like there will be poor eye contact. When you're calling the name, the child is not responding, even though you know that the child has a good hearing. Okay, the child may have repetitive kinds of play, like lining every objects in a line, or he would just go round and round. And the child will be hyperactive, not sitting at one place, not understand emotions, and he is not aware of strangers. So if you see any of these signs in your kids, so definitely this is a developmental issue, and we'll have to address that. Though only one sign, suppose it is not suggestive of autism, but yes, a spectrum of all these signs may be present. Each child may be different, he may not present with all the signs. So this is important. Next thing is, what is learning disability, as I was talking about. So you must have seen the movie Tare Zameen Par. So the character, the child character, had a issue with learning, the academic issue, which we call it as learning disability. It is more commonly called as dyslexia, though dyslexia is a type of learning disability, I would say. So how do you find that child is having learning disability, or who is at a risk? So I would say any child who is low birth weight, who was premature, or who has any kind of speech delay I was always talking about, or any NICU admissions, any neonatal issue, had respiratory breathing difficulty and was admitted in ICU, very severe kind of jaundice. All these children are at risk of developing various kinds of disabilities or delays, as we talk about. So learning disability is one of them, though we label the child as learning disabled only after 6 years of age, like at when the once the formal schooling start. But they do show some signs, so we can actually evaluate those children if they have any signs. So what are those signs? So the child in the initial phase may confuse word. He may not like stories or rhymes being read to them because they don't understand, definitely. And they may have a limited vocabulary. They would point more and gestures more instead of telling. And if they are not able to tell something, they may hit others, and they easily get distracted, they forget directions, they are clumsy. Also, they have trouble organizing things, like suppose these are types of flowers, these are types of animals, so these categorizations is difficult for them to do. This is many, this is few, all these kinds of pre-academic skills. And this may be difficult for the child. Some children, they may find it difficult to read the clock also, what comes first, what comes next, what comes last. So these are all early indicators, and we should be very wary of that. And if any issue, if you are finding, then definitely it should be intervened. So what happens once the child is, we identify the delay in a child, what do we do? So as we have a developmental center, and we have a unit over here. So what we do is, first, if the child comes to me, we do a complete medical evaluation. We take a detailed history from you with regards to his birth, because as I was telling, a lot of issues at birth may have problems later in the life. And we do a hearing and vision test if it is not done earlier. We do a developmental assessment, which involves assessing the child in all the domains, like gross motor, fine motors. It may be socio emotional. We may give you some questionnaires as well to assess the behavior of the child. And then finally we intervene, which may involve a team work. It may involve a lot of speech therapists, occupational therapists, psychologists might be there. And then we finally formalize, and then we follow up the child in this way. If necessary, we can also go in for some genetic evaluation if required, or brain imaging. So how can we promote the development? That is the most important thing. So at this age, as I was telling you, a lot of fine motor development takes place. So the pre-writing skills can be developed at this age. Like, we can provide the chalk to the child. We can provide a space or crayons, non-toxic one, for them to scribble. We can ask them to imitate our lines, straight line, sleeping line. We can ask them to make a circle, playing with colors with hands. A lot of play with the sands and clay and all dough. These kinds of things are also important. Also, let your baby help during the routine course. So suppose if you are doing, even if the baby is 15 months or 2 years of age, we can ask them to, like, suppose get me that plate, or give this to papa, or something like this. So that or if you are sweeping the child, actually they love it very much. Or they, you may teach them how to fold the clothes and all. So in this way, when you are interacting with the child continuously, so all these things help them to develop their cognition as well as the language. So when you are telling them to do something, they'll follow that. And also let them do their work. Many a times what we do is, if they are not able to do so something by themselves very fastly, we try to intervene. Okay, okay, I'll put that, I'll put your shoes, I'll put your dresses. But we should try, they learn only if they are doing it by themselves. So even if they are messy, it's okay. Give some, take out some more time, like start getting them ready some 15-20 minutes earlier for school or some party if you are going, so that they get sufficient time to do those activities by themselves, because this is the only way they'll learn. Also, activities to promote language development, reading to the child, a lot of reading. Even if the child does not understand every context, you can get those big books which have a lot of pictures and sentences in them. Playing name games with the child and playing the concept of, so suppose this is big, this is a big potato, this is a small potato. And a lot of teaching the child sharing skills. Give this to your cousin, give this, share this with your other sibling. And playing those rhyme games which has a lot of means activities, like this is some jumping activities, running activities. So all this will help in development of the child. And definitely having at least once a day, we should try to have a family meal together, either it be lunch or dinner, whatever suits you. If it's both, that is very good. And you should try to talk to the child at this time, age appropriate talks, like what is the best part of your day, which food do you like, how did you, and if the child is able to understand by 5-6 years, how did you help someone today, or what did you do in school today, so that the child develops and gets into the habit of narration as well. And they're coming on to common behavioral issues in children. So at this age, some children develop some kind of repetitive behavior. So head banging might be there, or they may just suck their thumbs, or they may just pull their hairs and all. So mostly, if the child has no other issues, no other behavioral issue, and this is happening only occasionally, and it is mostly at the time when the child is trying to sleep or he is not engaged in anything, then in that case, it is just to soothe themselves. And gradually, if we are ignoring those behaviors, this tendency to do all these habits come down. Okay, so as we say that if you are thumb sucking, the child will have a dental malformations. No, till 4 years of age it is not there. Only after that, if he continues to do that, or if he is damaging his tissue, means skin and all, then in that case it is a problematic behavior. Temper tantrums, many of us has seen this child in the mall or something, they want something, they'll lie down the road. So this is very common at this age. Okay, and then how to manage this is very important. So first thing is, any kind of behavioral issue, first you have to try to understand what we call it as ABC: antecedent, behavior, and consequence. So what is the antecedent? Why is this behavior happening? Sometimes we go for a shopping and the child is hungry and we have to finish our shopping fast, so we ask them to wait, and the child is cranky and he's doing that. So we have to figure out, is the child hungry, why is he doing that, is there any restricted access, is it for just attention, or is the child is finding the task very difficult to do whatever he's doing, and is he getting frustrated, is there any change in the routine that is happening and which is the child is not familiar with, like taking him to a new place and he is not familiar with the people over there and he throws a tantrum. So we have to understand what is the cause, and if we can try to modify it if it is possible. Otherwise, first thing, by initial years, 2-3 years of age, it is very easy to distract the child. And then if the child is not getting distracted, best thing is to ignore the bad behavior. So because what happens, if we are just move out, make sure that the child is in a safe zone and just move out from there. Most of the cases the child stops crying, because the child knows, like this, if I cry a lot, gradually if we are giving them something, then they will get into that pattern which we don't want. If you're taking the child to a new place, you show them pictures, maybe talk to him that what you are supposed to do at this situation. And whenever you are busy, suppose you are gone for a kitty party or some such kind of issue, you went for the hospital, you want to talk to the doctor. So in that case, definitely take something for the child in which the child is engaged, maybe some kind of game, and also that he doesn't get bored and he doesn't want your attention. And definitely always praise the positive behavior. You can, if the child is able to understand, generally by 3 or 4 years of age they can do so. So star works very much, like they like to have a lot of stars. So these kinds of star charts, or just putting the star in their hands, a golden star when the child has done a good thing that you have asked to do. So it it promotes them, it praises them actually. And as I was talking about ignoring the negative behavior, punishment very very rare, like in some rare situation, and that too not shouting or any kind of corporal punishment. What we can do is, if the child has done such a thing which cannot be ignored, like he just went and hit someone and all, then we can just remove the child from that activity, from some time from that group, and let the child understand that this is because he is not he is not allowed to play because he has done something bad. And when the child calms down, his anger calms down, or if he says, if he comes and apologizes, in that case you can ask the child to join the activity. So this is known as timeout. But we should try to like the time in should be there, more praising there, and this should be very occasional timeout thing. And as I was telling, clear expectation and a good modeling, they imitate us. So even when we are angry, we should try now not to shout to them, not to hit them, because what they understand is, like, whenever someone is angry, the thing is we have to hit others. So they learn this from us. So we should try not to do that. We should be a good role model for them, and we should always educate them what is expected from them. If you are going out somewhere, just teach them what is to be done at that place, so that they get a good idea and they start to imbibe those activities. And talking about screen time, no screen for children less than 2 years of age. Some video call with suppose grandparents and grandparents is around, but not more than that. And above that, maximum of 2 hours per day. And that should be interactive. So suppose some child is watching any Chota Bheem or Doraemon, you can just sit with the child and you can talk about what he is doing, and chalo, let's also do something like this. So it should be a two-way thing, not a one-way thing. And screen should never be used as a reward or a distraction. So because then once suppose generally by 6 7 months of age, what happens, the child, they don't want to be in one place and they want to move around by the time they start to crawl and all. So it becomes very difficult for us to make them sit. And suppose during the feeding time, so what do generally do, we'll show, they start showing them the screen because that is most handy and easily available for us. But then it becomes a habit from them, from there onwards. So we should never use it as a reward or a kind of distraction. You try to have something else. It can be some colorful toy, it can be something with a noise, it can be a good book or some kinds of story, and 3D pictures and all can be used. And most important thing is doing all this, like when the baby is born, we are so much engrossed into all this medical illness, immunizations, all those kinds of things, and even the routine thing, feeding the child. And also we tend to forget this thing which is most important, making our home accident safe. So this, I have kept only a few points over here. In the last line, I have mentioned the reference. This has a total checklist, how can you make your home accident safe, because that is very very important, because many children actually tend to even lose their life because of all these small small things. So suppose by 2 years of age they would start climbing, and also don't put anything near the balcony, it should be grilled as far as possible, or any window that the child can climb on and they tend to fall backwards. And never leave your child alone in the bathroom. The bathroom door should be locked. Any kind of bucket that is filled with water and all, any utensil, it should be kept covered, because drowning can happen for baby in a water which is even 3 centimeter in height. Also, things such as lighter, matchsticks, our medications. We see a lot of children who come with complaints of swallowing medications for the parents or grandparents, which can be sometimes very dangerous for them. So try to keep everything up, try to keep everything locked. Those harpics that we are using, those kinds of phenyls, those acids sometimes, and even the normal surf and all. So all these things should be kept in a cupboard and it should be locked always. And most important thing is, you as a parent should definitely take out time for yourself, be it a father or mother, at least half an hour day per day, so that you can and engross in anything you like, because only then, if you are healthy, then you can take care of your child, and parenting becomes much easier. So with this, these are few resources which you can refer. www.cdc.gov, reading rockets, these are very good milestone trackers as well, various activities to promote development, including all the domains. And if you have any questions, you can mail it to me on my email ID, and which is on the first slide. I will display it once again. and you can contact Ankura Hospital, and definitely me, myself, and our team will try to help you out. Thank you very much. If you have any questions, you can put it on the chat box, or you can directly contact us. We will try to sort that out.
Yeah. Thank you, ma'am.
Yeah.
Yeah,
Okay.
so we have one question on the YouTube. Is there any block test in 3.5 years?
Block test, yes. There are various kinds of tests like developmental assessment test, which is a DASI test, that development assessment scale in Indian infants, and also, but that is catering to only 30 months of age. Bailey's test is another test that is used, which contains a lot of block use and all. So it has various defined criteria that is to be used. So
Okay,
it needs training also, actually.
okay.
Yeah.
And if a kid is like around 3 years old kid, if they are throwing a lot of tantrums, like if they have some thing in particular to keep at some place, and
Hmm.
they want that object to be there only, nobody should move a bit inch from that place. So how to address those issues in kids?
Okay. So for this kid, I would definitely like to ask, is it only for one particular object, like one particular toy, or is it for anything else that is there? First thing we'll have to figure out this kind, is this with any other, all the objects it should be like that, like doormats or something like that. If it is with every object, that if it is moved from their place, the child gets disturbed, then we will definitely want to evaluate the child for other things also, because this is not a very common feature. But sometimes with respect to one or two toy which is their favorite, so in that case, even if suppose that is put to some other place, we can just tell the child, maybe communicate the child, see, your toy I'm putting over there. And if we inform the child prior, maybe he knows where the toys is, because sometimes they think that the toy is has lost, so they may throw a tantrum in that case. So, but if it is going to a tantrum kind of thing every time, then definitely we should, as I told you, inform them. And if it is he is hurting somebody or some other situation is getting very severe, then definitely we'll have to teach the child that this is not the way that we have to. Even if you want something, you will have to ask. So first, tell the child, if he is able to understand, okay. Otherwise, ignore the tantrums of the child. Once he settles down, then tell him to ask it in a calm manner. If he is asking, definitely you'll have to give that, means try to give that thing to the child, if it is something which belongs to him, like a toy or something. And if you have any, means if this query is there, means I would definitely like to know further why, which situations this is happening.
Okay.
Yeah.
And how to control the like anger issue, as you told that you should give a time out for that particular child, but how
Mhm.
long, like there should be some 2 minute 5 minute, because sometime some kid like start crying like for very long duration. So in that
Mhm.
condition, how to manage that behavior?
Okay. So, if it is again the kid is time, I mean, so, this timeout should not be used for a very small kid, because they don't understand. I was telling the consequence of their behavior.
Mm,
So, again, why is the child crying is the question I would like to ask, because the thing is, again, if it is for just attention seeking thing, or is it if the child wants something that he has seen in the mall, or some of these kinds of things. So try to take him away from that situation, and just distract him in the first place. If not, if he every time goes into a tantrum or some kind of head banging kind of activity, just move from that place and ignore him, and that will make him understand that even if I am throwing a tantrum, mommy or daddy is not giving up into it. Means they are, even once I'm quiet, only then I'm receiving those objects which I want, or in a better way.
okay.
Yeah,
And
timeout actually is the last resort, as I told you. If only the
mhm.
child is hitting someone or something, then only we should use. And by it should not be used in very small kids, because they won't understand. 5 years, 4 years is okay.
Okay. And many times it happened that if two, three kids are playing together of age group 3 years, 2.5 years, 3 years, 4 years, then one kid hits other smaller kids, and
Hmm.
when asked, the older kid will reply that other kids were creating problem for them, but
Mhm.
it is that it's an imaginary thing, like that nobody hits him, but again
Mhm.
he's telling that she hit me, he hit me. So why this
Mhm. So generally, this will happen because he will be wanting. He may not like. He may be wanting some other toy or something that other child is having. But at this stage, no one wants to share actually. So it may have been into a fight. Or if the child wants to play in some particular way and the other child is not responding or he's not able to understand, then it might lead to a frustration in the child. So in that case, like definitely we'll have to explain to the child if he's supposed 3.5 years that this your hitting others will lead to means he will be hurt at that point, and then definitely I will not let you play with him. The next time he won't want to play with you. So next time if you are facing any issue, either you have to tell them like what are the things that you can do. Either come to me and say me what is your issue, or you can ask him politely. So these kinds of modeling we need to do it again and again with the child. On one go it is not every time possible, but yes, with gradually if we try to make them understand, or maybe showing them picture, like suppose any other kid is hitting you or if he grabs thing from you, you can ask them politely what should be done in this situation. It will help definitely.
okay.
Yeah.
And many kids many kids we see around that they jump, they just go to the stairs very easily, but for few kids of the same age group only, they are very hesitant and they have fear that they will fall down, they will slip
Mhm.
down. So how to
Mhm.
encourage those kind of child?
Okay. So whenever you are going out, so you'll have to means be supportive with the child. Yes, some children do have fear of height and all, but that's okay. So it's a gradual thing. We'll have to expose to them gradually. Maybe we can start with a small step, and we can small start with a small swing, or making them jump on a small trampoline sometimes, and then gradually once he is okay and once he is comfortable, then we can shift him to something which is a larger one. So means gradual, we have to give them a reference,
Okay, ma'am.
exposure of things. Yeah.
Okay.
Okay.
Yes, ma'am. So, and what about the TV? Like in this COVID time, everybody is like busy. The parents are busy in their work and job, and then I think most of the people have TV as a solution to distract the child.
Okay. So in this situation, we'll have to means resist our resort to do that actually, and we'll have
Okay.
to definitely take something else. So see, because it is very easy for us, but it is bad for the child because it has been shown via research as well that
Mhm.
TV and mobile exposure leads to delayed language and a lot of behavioral issues in the kids, and a lot of attention problem as well, which is not good for the child. So we can engage them into something else, some kind of they may need some kind of toy. We can engage them in some writing work, some colored dough and all. Because see, 20 years back there was nothing, but still the children, they kept themselves engaged in some or the other way. So we'll have to find out solution. If it's a means 1.5 hour of TV watching is okay, but not more than that for a kid above 2 years.
Okay. Okay.
Yeah.
Yeah. So these were the questions, ma'am.
Okay.
Yeah, ma'am.
Okay.
Yeah.
If there
So
are no questions, then we can stop this thing, right?
okay, ma'am. So
Yeah. Okay.
thank you very
Thank
much.
you very much.
Yeah. So thank you, ma'am. Thank you, all the viewers, for this session. And I would like to thank Shruti, ma'am, for taking this session and giving very good, things about the child development, which every parent should know. So thank you, ma'am.
Thank you.